Thanks for coming out and watching the oxymoronic Reddit professional show, where I showcase the best and worst of the internet. Here I comment on brilliant and hilarious comment chains regarding dumb shit on the internet for you to enjoy. Make sure to subscribe, hit the little bell button so that you get notifications every time we come up with a new video. Enjoy this week's show. Doctors of Reddit, what is your most awkward experience when dealing with members of the opposite sex? My attending tells me to go examine a patient, her chief complaint being that she was beaten up by her boyfriend. So I go in to see a tall, very attractive blonde sitting there crying. I calm her down and ask her the usual questions, and then I explain to her that I have to examine her from the top to bottom to document the injuries. So far, the exam's going well, until it came down to her stomach, then to her waist, then bam, penis. Did not see it coming at all. I think my shocked expression for a split second caught her off guard, and she says, "Oh my god, I'm so sorry. I forgot to tell you, I'm transsexual." Yeah, I figured it out. I was the chaperoning nurse, young doc, first week in OB, and was seeing an early pregnancy PT in triage. Docs usually say, "I'm going to put my hand on your vagina now," or "You will feel the speculum on your lips, labia." He was rattled and so nervous he conflagrated them as, "I'm going to put my lips on your vagina now." The patient and I roared with laughter for a second before we controlled ourselves. He shakily kept his dignity and kept right on going like nothing happened. He never referred to it again for the 4 years he was there. When I was 16, I sometimes got dizzy if I stood up really fast. I'm pretty sure this is relatively normal, but my mom thought something was wrong with me. So she took me to the doctor and he wanted to check for testicular cancer. I had a worried look on my face because I didn't want an old Asian man feeling my nuts. The doctor saw my face and thought it might console me if he spoke teenager. He said in his Asian accent, "I'm gonna feel up yo balls." I felt pretty awkward after that. Somewhat related, but from a patient's perspective, when I was in nursing school, I went to my school's student health center for a gyno appointment. The doctor asked me if I was alright if a medical student was present. I said that was fine. She then specifies the student was male and asks me if that was still okay. I wasn't totally comfortable with that, but as a nursing student, I knew how much it sucks when a patient refuses you, so I said yes. Lo and behold, it was an incredibly attractive med student from my school who I bumped into all the time, and he saw the inside of my vagina. I could never look him in the eye after that. Edit, a lot of people are commenting that he or I should have refused. I didn't actually know the guy, I just knew him as a hot stranger, and I think I became much more aware of his presence after this occurred. We are taught to explain to patients exactly what we are doing as we are doing it. Delicate wording becomes important during female pelvic exams. Instead of, "Okay, I'm going to place the speculum inside now so you'll just feel some warm pressure," my buddy ended up saying, "Okay, I'm coming inside you now." The female patient responds, "No thanks, I already have 3 children." Not me, but a fellow classmate in medical school. We have mock exams and various people will sign up to be patients. They get paid a decent amount. So he went in the mock exam room and started the basic history and physical on the fairly attractive female. Did this and that, pretty standard stuff, grabbed a tongue depressor and had her open her mouth. Then nothing. He did it again, and he said with bewilderment, "That is weird. You do not have a gag reflex." She smiled and gave him a coy wink. He about lost it and couldn't finish. He walks out and finds the preceptor who monitors the exam about rolling on the floor laughing. As for me, I never really had an overly awkward experience other than maybe knowing someone, which can make certain exams a little awkward. I would preface by saying that the word opposite doesn't quite fit here. Last year, I had a transgender patient, FTM, who had completed their transition, hormones and mastectomy only, for now, and had been living as a man for about a year or so. One day, he called me and asked me if he could have a blood test for HPV. I told him that the only test for HPV was a cervical swab. To be thorough, since he still had a uterus, we could do a pap smear with a swab to check for HPV. He agreed. It was a difficult and painful exam. He'd never borne children while a woman, and the testosterone he was taking made his vaginal canal smaller and drier. Even with the smallest size speculum, it was very uncomfortable for him to complete the exam. It was awkward for me, not just because of his pain, but because he had been content with his transition and was living happily as a man, and then I had to go and give him an intrusive, painful reminder that he used to be a woman. It felt like a violation to me, much more so than the usual pap or rectal exam, like I was somehow going against the transition he'd worked so hard for. Of course, to top it all off, the lab lost the HPV sample. We'll have to repeat it again sometime this year. Thankfully, at least he has an amazing attitude despite this. I still feel awful about the whole thing.
After receiving an internal exam from my GYN, he asked if he could bring a medical student in so they could get some practice. I agreed, thinking he meant a student. He took a good 10 minutes, but after that, in walked a group of about 5 people, male and female. They each took turns putting their fingers in my vagina, then talking about me like I wasn't there as they reported what they felt to my GYN. Syphilitic chancre? Cystocele? With his back turned to me, my GYN corrected them and told them exactly what they had been feeling. It's her penis, attached to the interior wall below the cervix. Her urethra is inside her vagina. She was born with ambiguous genitalia and had cosmetic feminization at 2 years of age, but the surgeon missed the internal structures. And that's how I discovered that I was born intersex and my parents opted for me to have a labiaplasty as a toddler. ER in Brazil. 20-year-old woman receives a knife cut in her chest, slides both of them across. Superficial injury, but it needed stitches. No plastic surgeon. SUS ER in Brazil. Started the procedure. You like them, don't you? If you make them pretty again, you can play with them all you want. The nurse was mortified. This would go on for 45 minutes. As soon as the next doctor on schedule arrived, I was ending the stitches and referred her to the other doctor and noped out of there. Oh, I have another one. Me this time. I was in my OBGYN rotation and this young redhead came in for genital warts. Let's just say that the curtains matched the carpet and, pun intended, she was a bonfire down there. So me and my preceptor at the time were looking for warts in the forest down there. We would find one, freeze it, find another, freeze it. I got lost in the moment and forgot where I was, as I was just a student and not yet fully developed professional composure. I saw one and said, "I found one, a big one too." Realizing what I said, I looked up from between her legs as she looked down and we locked eyes. The embarrassment in her eyes is something I will never forget. I felt like a giant ass. My doctor once said, "You're so thin, it's very easy to palpate your organs." Then he felt my spine from the front, and it was awkward. When I was in nursing school, my lab partner was a Kenyan marathon runner. He was so skinny, our teacher used him as an example all the time because you could literally see his heart beating through his chest in his intercostal spaces. And where his lungs were a little overdeveloped from running, he could take a deep breath and you could almost see the outline of his liver. He always had to take his shirt off and let people prod and grope him. Being a resident in Saudi Arabia, there's a huge stigma attached to male attendings examining female patients, especially those with gynecological issues. Also, being a foreigner residing here, some customs and practices catch me completely off guard at times. That being said, I was once in charge of my consultant's OPD during an OBGYN rotation, said consultant having left early thinking all major cases and appointments had been dealt with, and left me to clean up any stragglers in the last hour. In walks a 40-year-ish old mother with her 18-year-old daughter, both completely covered from head to toe in burqas, who then proceeds to throw a tantrum about how the consultant wasn't there for her appointment, and how she left a male resident in charge of the OPD. A cursory examination of the daughter's file didn't reveal any history, which would have helped me decide if my superior should get involved. I then began to try to talk her down, asking her what her appointment was about and how I was in charge of the department. I didn't dare reveal I was just a lowly resident, and I would do everything in my power to help her out with any issues her daughter had been having. After a lengthy conversation, I find out that the daughter was there for virginity verification because she was to be engaged and subsequently married off that month, and appointments in my hospital's OPD are a bitch to get. And they needed to present that certificate along with some others regarding finances, genealogy, and a few others to the prospective groom during the engagement ceremony. I went completely numb, detached, examined the poor girl silently. She was in the stirrups, naked from the waist down, and burqa above that, not even an eye slit. And discovered for the first time a stack of thick, extremely official-looking certificates in a desk drawer to be given to women who passed the examination. Since performed that examination close to 30 times and have seen quite a few females who didn't have an intact hymen and actually sobbed quietly in shame during the examination. I try to explain to the family that the hymen rupture is in no way a sign of promiscuity or even sexual penetration. People I know wouldn't understand. I just certify their daughters' virginities and tell the girl to come up with an excuse later on to their families. Someone tells on me and I'm going to be facing one hell of a malpractice suit. Third year of medical school on my family medicine rotation, which I'm doing on my med school's campus academic health center. Electronic medical records show 24-year-old with chief complaint of cough, so I go in to interview her, where it comes to light she's really there for vaginal itching. Finish up the interview and tell her I'm going to grab my attending for the pelvic exam. My attending tells me she'll let me do the pelvic if the patient consents. I had already done OBGYN at this point and was quite comfortable with it. But we both agree I'd likely get asked to leave the room altogether. Lo and behold, patient consents. I do the pelvic, we write her a script for some antifungals, and she goes home. 2 days later, I'm teaching a small group of first-year students how to perform an abdominal physical exam. Teaching is a requirement of the family medicine rotation, when, during introductions, I come face-to-face with my patient who never mentioned she was a first-year student. We both play it off really cool at first, but during the session, her partner asked me to show him how to do an inguinal femoral hernia examination on a female patient, aka his partner. While I'm doing my exam, she breaks out in hysterical laughter, which causes me to lose it, and I start laughing at the absurdity of the situation as well. She played it off like she was ticklish, and I said something stupid like, I thought of something funny, don't mind me. 2 weeks later, she returns to the clinic for a follow-up, and I go see her. We talk for a while about how she's feeling, how awkward our second meeting was, and then just shoot the shit for a bit when she goes, "So when are you going to take me out for dinner?" I politely declined and explained I had a girlfriend at the time and never saw her again. TLDR, I did a pelvic exam on a girl who ended up being a fellow medical student, though 2 years behind me, and asked me on a date at her follow-up appointment. My pediatrician used to substitute this old male doctor sometimes without notifying anyone. It was almost always the days I was coming in for my sports physical. That feel when you're going to get your balls touched by a lady doctor in your early teens and then seeing an old man snapping latex gloves on. Patient side of the story, I got a positive on an STD test, so to take the secondary test to make sure, I went to a public health care center located near me. The blood drawer person was extremely cute, so when she drew my blood, I was striking up a conversation just to be friendly. She says, "You're awfully cheerful for a person that doesn't know if you have an STD or not." I tell her, "Well, you'll let me know if I do?" She gave me a smile and left. When someone came back, I shit you not, I was facing the other way and said something charming flirty only to turn around face to face with an old lady doctor. She even had a sense of humor and said, "You can call me when you know you're clean." She was the kind of woman that you can tell used to be pretty about 20 or 30 years ago, but age took its toll. I got embarrassed, asked for when to come back for results, and left. Weeks later, I go back, see the same old lady doctor, and tells me I'm clean. I left before any awkwardness bubbled up.
If you enjoyed this week's effective way to waste time, hit that like button and subscribe for more content like this. If you are enjoying the series, leave me a comment below. A special shout out to the content creators. You frickin' rock.